Leprosy, also known as Hansen's disease, is a chronic infectious disease caused by the bacterium Mycobacterium leprae. It primarily affects the skin, peripheral nerves, mucous membranes, and eyes. Although it has existed for thousands of years and was once feared as a highly contagious and incurable disease, modern medicine has made great progress in controlling and curing leprosy. Today, it remains a public health concern in some parts of Asia, Africa, and Latin America, but is no longer the devastating disease it once was. Historical background. Leprosy is one of the oldest known diseases in human history. References to it appear in ancient texts from India, China, and the Middle East, often describing sufferers being isolated from society due to fear of contagion. The disease carried heavy social stigma, and those affected were often shunned or forced to live in leper colonies. The true cause of leprosy was discovered in 1873 by the Norwegian physician Gerhard Armaur Hansen, making it the first human disease to be linked to a specific bacterium. His discovery was revolutionary, leading to more scientific approaches to treatment and control. Causes and transmission. Leprosy is caused by Mycobacterium leprae, a slow-growing bacterium related to the organism that causes tuberculosis. The exact mechanism of transmission is not fully understood, but it is believed that leprosy spreads mainly through prolonged close contact with an infected person via respiratory droplets from coughing or sneezing. The bacterium is not easily transmitted. In fact, most people have a natural immunity to it. Only a small percentage of those exposed develop the disease. It is important to note that leprosy does not spread through casual contact, such as shaking hands, sharing food, or touching objects handled by an infected person. The incubation period can be very long, sometimes 5 to 20 years, which makes tracing the source of infection difficult. Types of leprosy. Leprosy manifests in different forms, depending on the immune response of the infected individual. The main types include tuberculoid leprosy, paucibacillary. This is the milder form, characterized by a few well-defined skin lesions and limited nerve involvement. The patient's immune system is strong, and the bacteria are few. Lepromatous leprosy, multibacillary. This is the more severe form, involving multiple skin lesions, nodules, thickened dermis, and significant nerve damage. The immune response is weak, allowing the bacteria to multiply extensively. Borderline leprosy. This form has features between the two extremes and can shift toward either type depending on the body's immune reaction. Symptoms. The symptoms of leprosy develop slowly, often taking years to appear after infection. Common signs and symptoms include pale or reddish skin patches with loss of sensation, numbness or tingling in the hands, feet, or limbs, muscle weakness leading to deformities or difficulty gripping objects, thickened, dry skin or lumps on the body, nosebleeds or stuffy nose due to mucosal involvement, eye problems, including loss of blinking reflex or vision impairment if the facial nerves are affected. If left untreated, leprosy can lead to permanent nerve damage, muscle weakness, paralysis, and deformities, especially in the hands, feet, and face. Diagnosis. Diagnosis is usually based on clinical signs such as skin lesions with sensory loss and thickened nerves. Confirmation is made through skin smears or biopsies, where the presence of Mycobacterium leprae is detected. Early diagnosis is essential to prevent disability and transmission. Treatment. Leprosy is curable with a combination of antibiotics known as multi-drug therapy, MDT, introduced by the World Health Organization, WHO, in the early 1980s. The standard regimen includes dapsone, rifampicin, and clofazimine, administered over 6 to 12 months depending on the severity. Treatment kills the bacteria, halts disease progression, and prevents disability. Once treatment begins, patients are no longer contagious. WHO provides free MDT to all patients worldwide, making leprosy elimination possible in most countries. Supportive care, including physiotherapy and reconstructive surgery, helps manage complications and improve quality of life. Prevention and control. Prevention efforts focus on early detection, treatment of cases, and public education to reduce stigma. Close contacts of leprosy patients are often monitored for symptoms, and in some regions, preventive antibiotics are given. Improving living conditions, nutrition, and hygiene also reduces susceptibility to infection. Social stigma and awareness. Despite medical advances, leprosy still carries social stigma in many societies. Misconceptions and discrimination persist, causing psychological distress and social isolation for patients. Awareness campaigns aim to educate the public that leprosy is not highly contagious and completely curable with early treatment. Global situation. Leprosy remains endemic in a few countries, particularly India, Brazil, and Indonesia, which account for most of the world's cases. The WHO continues to work toward the global goal of zero leprosy, emphasizing human rights, community-based rehabilitation, and inclusive health care. Conclusion. Leprosy, once seen as a mysterious and terrifying disease, is now fully understood and curable. With effective antibiotics, early detection, and social support, millions have been cured, and its spread has greatly declined. The biggest challenge today lies not in the bacterium itself, but in eliminating stigma and discrimination, ensuring that every patient receives compassionate and timely care.